Chronic lymphocytic leukemia, often abbreviated as CLL, is a type of cancer that affects the blood and bone marrow. It's a complex and intriguing condition that starts in the very cells responsible for defending our bodies against infection, which are called the lymphocytes. At its core, CLL is a cancer of B lymphocytes, which are a type of white blood cell that plays a crucial role in our immune system. In a healthy individual, these B cells develop in the bone marrow, mature, and then circulate in the blood and lymphatic system, ready to fight off invading pathogens. However, in CLL, something goes wrong in this process. The body starts producing too many of these lymphocytes, but here's the problem: that are not the strong infection-fighting cells we need. Instead, they're immature, dysfunctional cells that don't die when they should. So they accumulate over time, crowding out healthy blood cells and weakening the body's ability to fight infections. What makes CLL particularly interesting and challenging is its chronic nature. Unlike some aggressive forms of leukemia that progress rapidly, CLL often develops slowly over months or even years. In fact, many people with CLL don't even know they have it at first. It's not uncommon for the disease to be discovered during a routine blood test, long before any symptoms appear. CLL is the most common form of leukemia in adults in Western countries. It's estimated that there are about 20,000 new cases diagnosed each year in the United States alone. The disease primarily affects older adults, with the average age at diagnosis being around 70 years. It's relatively rare in people under 50 and is almost never seen in children. Causes of CLL. Like many cancers, the exact cause isn't fully understood, but we do know that it involves changes in the DNA of blood-producing cells. These genetic changes, or mutations, cause the cells to produce abnormal lymphocytes that don't die off when they should. Instead, they accumulate and crowd out healthy cells. Several risk factors have been identified for CLL. Age is a significant one. The risk increases as we get older. Family history also plays a role. If you have a first-degree relative, like a parent, sibling, or child, with CLL or another type of blood cancer, your risk is higher. Exposure to certain chemicals, such as Agent Orange, used during the Vietnam War, has also been linked to an increased risk of CLL. Interestingly, while these risk factors are known, they don't tell the whole story. Many people who develop CLL don't have any known risk factors, and conversely, many people with risk factors never develop the disease. Symptoms of CLL. As mentioned earlier, many people with CLL don't have any symptoms at all in the early stages. The disease is often discovered through a routine blood test that shows an elevated white blood cell count. However, as the disease progresses, symptoms can develop. Fatigue is often one of the first noticeable symptoms. This isn't just your normal tiredness after a long day. People with CLL often describe it as a profound, bone-deep exhaustion that doesn't improve with rest. It's the kind of fatigue that can make even simple tasks feel like climbing a mountain. Swollen lymph nodes are another common sign. These usually appear as painless, rubbery lumps in the neck, armpits, or groin. While swollen lymph nodes can be caused by many things, including common infections, in CLL they tend to persist over time and may gradually increase in size. As the abnormal lymphocytes accumulate in the bone marrow, they can interfere with the production of other blood cells. This can lead to anemia, or low red blood cell count, which can cause shortness of breath, dizziness, and pale skin. It can also result in thrombocytopenia, or low platelet count, which can lead to easy bruising and bleeding. Some people with CLL experience unexplained weight loss. This isn't the kind of weight loss you'd get from a new diet or exercise regimen. It's often significant, 10% or more of body weight, and occurs without trying. Night sweats are another symptom that can occur in CLL. They're often described as drenching sweats that soak through night clothes and bedding. As the disease progresses and the immune system becomes more compromised, people with CLL may experience frequent infections. These can range from common colds that seem to linger for weeks to more serious infections that require hospitalization. Some individuals with CLL may develop an enlarged spleen, also called splenomegaly. This can cause a feeling of fullness or discomfort in the upper left part of the abdomen. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of CLL. Diagnosing CLL typically starts with a blood test. If a complete blood count shows an elevated number of lymphocytes, further testing is usually recommended. This often includes a test called flow cytometry, which can identify specific markers on the surface of the abnormal blood cells that are characteristic of CLL. A bone marrow biopsy may also be performed. This involves taking a small sample of bone marrow, usually from the hip bone, to examine under a microscope. While this test can provide valuable information about the extent of the disease, it's not always necessary for diagnosing CLL. Genetic testing of the leukemia cells is becoming increasingly important in CLL. Certain genetic changes, such as deletions in chromosomes 11 or 17, can affect the course of the disease and how it responds to treatment. This information can be crucial in determining the best treatment approach. Treatment for CLL. Unlike many cancers where immediate, aggressive treatment is necessary, the approach to CLL is often more case-specific. In fact, for many patients with early-stage CLL who aren't experiencing symptoms, the initial approach may be what's called watchful waiting or active surveillance. This might seem counterintuitive. After all, if you have cancer, shouldn't you treat it right away? Well, that's right, but in CLL, immediate treatment doesn't always lead to better outcomes, and it can expose patients to side effects of treatments unnecessarily. During watchful waiting, patients are closely monitored with regular checkups and blood tests, but treatment isn't started until the disease begins to progress or cause significant symptoms. When treatment is necessary, there are several options available, and the choice depends on various factors, including the patient's age, overall health, and stage of the disease. Chemotherapy has long been a main treatment for CLL. Drugs like fludarabine, cyclophosphamide, and bendamustine can be effective at killing cancer cells. However, they also affect healthy cells, which can lead to side effects like nausea, hair loss, and increased risk of infections. Targeted therapy is another important treatment option for CLL. These drugs work by targeting specific features of the cancer cells, often with fewer side effects than traditional chemotherapy. Ibrutinib, acalabrutinib, and venetoclax are examples of targeted therapies that have shown remarkable effectiveness in treating CLL. Immunotherapy is another exciting CLL treatment. Monoclonal antibodies like rituximab and obinutuzumab work by helping the immune system recognize and attack cancer cells. These are often used in combination with chemotherapy or targeted therapies. For younger, fitter patients with high-risk disease, a stem cell transplant might be considered. This procedure involves replacing the patient's diseased bone marrow with healthy stem cells from a donor. There are two main types of stem cell transplantation: autologous, where the patient's own stem cells are used, and allogeneic, where stem cells from a compatible donor are used. Allogeneic transplantation is more commonly used for CLL and has the potential to cure the disease, but it also carries significant risks, including graft versus host disease and infections. At the end, it's important to note that the prognosis for CLL has improved dramatically in recent years. Many patients live for many years with the disease, and some may never need treatment. Also, clinical trials are still continually exploring new drugs and treatment combinations, offering hope for even better outcomes in the future. Now, we want to hear from you. Do you or someone you know have chronic lymphocytic leukemia? What treatments did you have? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.